Hi, Brittany McKinney here doing journal number 5. It's our last journal, and so I have a little couple different feelings around that. I think it's exciting and it's pretty it's just a lot of things. Like we're wrapping up what a journey we've had. And so our journal 5 is going to go over competency 9, which is evaluate individuals, families, groups, organizations, and communities. To me, this competency, we're gonna apply this a lot, especially in our rural settings. Whenever we are working with different populations, I think it's important that we have a culturally acclimated approach. So we do kind of understand our target population, and there's just going to be different modalities that is more effective with different clients. And so it says provide a brief summary of the assignment that you completed. And I believe that it was talking about the interventions practice online assignment. I think particularly whenever we're talking about like the interventions is whenever we're starting to do our biopsychosocials and we're putting our treatment plans, right? And then we're talking about our interventions, whether it's going to be what screeners we're going to use, if we need any outside referral resources, like maybe somebody needs, for instance, I have a client that needs an autism evaluation right now. And in order for me to really move forward with some of the things that we need to do with our treatment plan is to get these evals done and to collaborate with the community in these different settings. And then how does this assignment relate to your practicum? The assignment of sorry, I keep losing my wording. The assignment of the intervention practice relates to our practicum because we're going to need to be able to effectively assess the people that we see, and we're going to be able to offer our clients different interventions at different levels. For instance, what I may be working on with one client may not work with another client, and vice versa. And I think it's also a chance to see that sometimes the interventions that maybe we're working, whether we're doing just some cognitive behavioral therapy, isn't quite enough for somebody who maybe needs a little bit more intense therapy like EMDR. And I think just being willing to do our evaluations, work our treatment plans, and then come back with our treatment team and say, hey, this is working or it's not working. Talk it over in supervision, or even, kind of discuss it with your colleagues about like, okay, how have you done these different interventions in these settings? Relating this competency for this journal to what we're doing in field placement right now. In field placement, I've kind of just been kind of a little bit stagnant. I'd like to say, I took my PRE exam a couple weeks ago and just kind of reviewing that, making our plans, trying to figure out what that looks like, scheduling my exam, and just kind of going over supervision, like some of my weak spots and things that I need to work on as a clinician. I think applying this, I'm going to apply this in everyone that I see, whether it's with my targeted case management right now or even with my clients that I'm going to be seeing therapeutically. Let's see. Discussing my understanding of this competency. To me, this competency is says evaluate individuals, families, groups, organizations, and communities. This competency to me means that like we just kind of use our cultural competency within our client settings. I think that, education, language barriers, even like, history is all going to play a part in each individual's treatment and kind of how receptive they are to treatment. I know, for instance, if you were to interview, let's say maybe a 6-year-old person from my hometown of Morgantown and ask them like how open they were to mental health treatment, they're probably not going to be as savvy about treatment modalities as, let's say, a 20-year-old from Bowling Green or 30-year-old from Bowling Green or even a 60-year-old because of the different resources that we see in different communities and even just generational changes. We have how have you engaged in the behaviors for this competency? let's see. I think that I've engaged in these behaviors, just between my interviewing skills. We're going to use these questions in our biopsych socials. We're going to use them even in just in our daily interactions with our clients and even with our colleagues whenever we're talking about like how we are treating people in this setting. I think I use it in evaluations and in doing some of our or some of my reports. I'm always going to be using, a family setting or a different theory or approach to try to figure out, okay, what is the best modality for me to treat this client? Next, we have briefly, what are you doing in field? What are you learning? Like I said, we've just been kind of going over some of our PRE stuff. I am transitioning from becoming a TCM to a CSW, and so I just need to finish my application for my exam. I kind of got, I don't know, part of the things that I get hung up on is I still am in the process of expunging my criminal record, but in between that, I had to go to my county of original conviction and get certified copies of all of my papers, and then submit those on top of all of the application fees and things like that. And I'm somebody that like I want to sit down and get it done once. And so if I have to do 15 things, then I get it done, but my ADHD gets a little frustrated. And so I have to really try to remind myself to stay on task and do A, B, and C and D, and then go back for EFG. But I'm grateful to be able to have the skill set to even be able to get those things done today. Because there was a time when I would just say, I don't know how to do it, and I wouldn't do it. Describe your strengths and experiences at your agency. I still think some of my strengths is just life experience. I found that um, I found that what I used to think, with like my record or even some of my experiences in recovery and things like that would kind of hinder me from having to check some boxes that I don't necessarily want to. It kind of gives me an up in a certain way. Just having experience to kind of see what people went through, or maybe how to offer different suggestions of how like I've felt in the process of some of these things before in my own life. And then how have your experiences challenged you or helped you grow as a professional? Master's level training. I may have mentioned this before, but I've had to do a lot of deprogramming between working a program of recovery and treating my clients. For instance, I may have a client that has chosen to be on MAT, right? And they consider that they're still in recovery. I think there was a time that I would have utilized my own recovery approaches and not considered this person in recovery. However, I think that I have developed more of a harm reduction modality, because I do believe that everyone's treatment can be different, and one person's recovery journey doesn't have to look like the next. But it's taken me years to deprogram from that, from I feel like what I was taught, like complete abstinence is the only way to go. And so those are kind of changing a little bit for me. I think cultural competency too. I'm from a pretty small town, and so I've gotten to see the dynamic of how rural atmospheres does kind of make a difference in where you come from and kind of the community setting that you're working with. Discuss the feedback you've received during supervision and how you're using that feedback. So I got fired for my first time from one of my intern clients, and just in full transparency, I was like doing TCM work with this client, and then we were transitioning because she needed a in-person therapist, and it was kind of just like a murky situation because the mom had ended up going to jail. The grandma ended up with custody. Grandma didn't want to sign ROIs for me to talk to other family members I had previously been talking to. And so there was just a lot of rebuttal in a lot of different ways. And I had gotten pretty sick the last few weeks. I'll address on that at the later end of this little video. But long story short, they decided to go a different route because she wanted more of a art therapy approach, and I'm not certified in anything like that yet. And so it just wasn't working schedule wise, which is really funny because we had just happened to do a termination setting, like a termination class in my family interventions. And we were talking about different, reasons and why things get terminated, whether it's the clinician terminates or the client terminates, and how we're, moving towards termination from the very beginning. And so just discussing kind of that like rejection sensitivity stuff with my supervisor, and realizing that like we will lose clients sometimes and it's okay, and not letting my people pleaser take over and really feel like a failure, because I'm grateful for the work that I got to do with the child whenever I did. And I'm also hopeful that she will find a clinician that can better meet her needs for where she's at right now too. And then discuss feedback. Still to just continue to give myself some breaks. I think I've had a pretty crazy last couple weeks, and sorry, I had to stop for a second and got interrupted. Um, Feedback during supervision, I think I was touching base on just continue to allow myself some self-care time. And that's actually gotten a lot easier throughout this semester, is prioritizing like my mental health and my physical health, because I know that like I only have one body and one mind and I need to take care of it. Let's see. Thoughts, feelings related to your progress as a professional in training. I don't know. I'm pretty proud. I think we're at the end of at least my education setting. I've thought about like doctorate and stuff, but probably not for a while. Let me get through the crazy toddler years of both my two littles. But I think that the imposter syndrome kind of goes away a little bit. And I was happy to pass my PRE. So that makes me feel a little more confident in taking my CSW exam, which I'm not a good test taker. So I was pretty anxious about that. And I hope that it can go as smooth as, the PRE did. And I need to finish scheduling that this weekend, which is what I'm probably going to be working on next. And then it says, what ADE practices have you observed in your agency? Provide examples. I don't have a lot in my agency right now. I think that we're still kind of dealing with the same, just the same like Medicaid things that we've been seeing change with certain demographics. I can say that I've seen some of the changes in just in not our department, but in school, with having to change the language for the things that we offer. Seeing some of the changes in government right now, like I think I saw yesterday an article that a university in Ohio was taking away like certain degrees that specify like a specific population, for instance, like women's gender studies or like African studies. And I don't know, man. Without getting political, I can just say that I see those as ADEI in certain ways, and I'm interested to see how this is all going to continue to play out. And then review your current self-care plan. What's worked? Do I anticipate any barriers? And how will my plan change? Well, for instance, I got pretty sick a couple weeks ago. It was just supposed to be a routine gallbladder surgery. And I went and took care of that. And then, however, I continued to not feel very well this last week. And come to find out, I had a blockage in my bile duct and I was turning jaundice. And so I had to go for another surgery. And I've essentially ended up having like 4 or 5 different procedures this last month, just between I had a tubal, and then I had like a root canal, and I had all of these things, and trying to plan around taking care of the kids and making my appointments and making sure I'm still seeing my clients and just having flexibility and making it all work. I think part of my self-care plan needs to start to be like, okay, you have a day a week for your appointments, Brittany, and start making my appointments instead of putting them off, because I'm really good about taking care of the kids and the husband and the family and the clients and all of the things, but not myself. And so I think this has been, survey says throughout the year that prioritize myself, make my appointments, keep my appointments, and also be okay with not being perfect, because that's not life. And yeah, I think my self-care plan will be changing as my schedule changes. I don't have internship hours anymore. I just have work. And yeah, just being okay with the ever evolving changing of our schedules. It has been quite a year. I'm grateful that this is our last journal to turn in. I appreciate all the help that you've given me in my clinical experience and in our classes, and I hope that you have a good rest of the semester as well.